Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up, deep concern about the mosquito-borne Zika virus, which is likely coming to the U.S. and soon. This week, the CDC confirmed what's long been feared about the virus. Here's John with more.
The CDC said confirmation the Zika virus causes microcephaly, an underdeveloped brain at birth, is unprecedented. It's the first time in history a virus transmitted by mosquito bite has been found to cause birth defects. Dr. Sonia Rasmussen with the CDC.
What we're learning is that they have a severe form of microcephaly that is oftentimes associated with other problems in the brain that can be seen on imaging, on CT scans or MRIs that make us really concerned.
The CDC says it made the determination based on mounting evidence from many studies. Images released by researchers in Brazil, where the virus is widespread, show severe brain damage in babies with microcephaly. The white areas are signs of calcium, felt to represent destruction, inflammation, and scarring in tissues of the nervous system. The researchers said the damage was extremely severe, indicating a poor prognosis for neurological function. Obstetrician Dr. Jennifer Wu is with Lenox Hill Hospital.
This is not something that will go away, and this is something they'll have to live with for the rest of their lives.
Researchers are just at the beginning of learning about the dangers of Zika infection.
Typically, we find out about the tip of the iceberg first, and then we learn more. Sometimes it takes years to understand the full spectrum.
John, health officials said this week that Zika is scarier than they first thought. So what does that mean for us?
Well, I'm very concerned about that. My colleagues are very concerned about that. And one of the concerns is, are we throwing everything we have at this virus, especially before the mosquitoes are actually upon us in full force? So time is of the essence. The resources have to be there in time. And one of the debates, you've heard about it, is that there's controversy over the fact that about 2 months ago, the White House requested nearly $2 billion from Congress to help fight the Zika virus. So far, those funds have not been allocated. So I went down to Washington and I spoke to some of our representatives, our legislators, including Congressman Tom Cole, who's a Republican from Oklahoma, who heads up an appropriations subcommittee that helps decide will the funds be allocated.
He guaranteed the money will be there.
It was very reassuring to me. He said, look, I get it. And I really felt, my impression was he does get it. He said, I guarantee the money will be there, which is terrific news. And I have to say that I spoke to a senior public health official who said to me that, following my conversation with Tom Cole, and he said, yes, actually, talks are going along much better, and he is encouraged that the funds will be there.
Well, moving on, this week, a government